Hi folks, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
Oh, in our opinion, of course, Bob.
And that's what all that matters, Brad. Today we're going to talk about 10 steps to help prevent knee surgery and knee pain. We're going to kind of show you what to look at and what to do if you do find something.
Right. And the big thing about knees is you got to be nice to them, but you got to keep them moving, okay, in a nice way. And that's what we're going to show. But first of all, 3 big things, Bob. Well,
okay.
4.
4.
The first one is we got some more people that just walked in.
Well,
See
hello,
it, right?
Thank you for coming. If you are new to our channel, please take a second to subscribe to us. We provide videos on how to stay healthy, fit, pain-free, and we upload every day. Also, if you have an extra second in your day, go over to Facebook and like us, because Brad and I, as children, were not liked, and now as adults, we're trying to turn it around.
Right. It's working, Bob. I'm feeling better every day.
You look better.
Okay. Wow. Okay. Next thing I knew, range of motion. As a therapist, almost always the first thing you do when you assess someone is look at the range of motion.
How well is that knee moving?
Right.
How well is it?
It doesn't matter if it's a
straightening?
knee or ankle.
Yeah,
or neck,
exactly.
You know.
It's a big factor.
And the nice thing about whether you're working with an arm or a leg is you can always compare it to the other one.
Right.
So if my left knee is the one that's bothering me, I'm going to see, is it going fully straight? As it is it bending all the way? Because here's my good one. I can straighten it out all the way, and I can bend it all the way, and I know that's good. And if this one...
So you don't even need any tools to tell whether or not it's not straightening all the way or bending. You just compare it to the other one.
Yeah. And so I'm just going to look at this one. Where is that stool, Bob?
Right here?
No, the rolly round one.
Oh. Yeah, this is a good way to do it. You're actually going to put your both legs up there. And if one of them, let's keep this one bent.
Yep.
If one of them is not straightening out all the way, you know that one has a range of motion problem.
Right.
And ideally, the more you can straighten out a joint, the less pain you're going to have.
Sure.
And they have kind of shown that to be true, is that for every degree that you gain, you can lessen the pain.
Sure.
In the knee, so.
Yep. So we want to get full range of motion there. There may be some circumstances if it had surgery or major injury, there may be, but if it has no history of severe problems, we want to get them equal, okay?
If possible.
Sure. So, should we...
and the same as with the bending, right, Brad? I mean, if you...
Right.
Would a way, like if you lay down flat on your back, is that a way to look at it?
Sure.
So...
This is what I'll do in the clinic. I'll say, as a matter of fact, yesterday I had a person with a knee problem. I asked her, just do this with your good knee. So she did this. It was normal. And I said, do that with the other knee. And sure enough, she couldn't do it as far. Plus, she had pain right there.
And they can feel the difference quite often. They go,
Right.
oh, that one feels tighter.
Right.
You know, so, and then that's a problem.
Right.
So we need to try to stretch it.
So, for example, if flexion is the problem, or it's not bending as far, you could actually do a stretch right here. There's a lot of different ways to do it, but I like ones laying down where you can be relaxed. That way the muscles are relaxed. And I'm going to come over here like this, and I'm going to work that joint and here.
Gently.
Gently, right?
But you can do pressure on, pressure off, or you can do just onward stretches where you stretch it for like 20 seconds, a sustained stretch.
Do you want to show them the bonus, Bob? The one where you do the rotation, Mulligan Technique?
I'll do that right on here.
Sure.
So this is a Mulligan Technique by Brian Mulligan. So what you're going to do is you put your foot up here, and depending which leg you have, with this one, you're actually going to turn it counterclockwise. So I'm grabbing the lower bone here, the tibia, with my hand, and I'm turning it, and I'm keeping pressure on it, and while I do pressure, I bend the knee. And this often helps with meniscus problems, or it helps with joint problems. And the whole time I'm turning it the whole time I'm moving.
Obviously, you have to be very stable on your leg. You know, if you're an elderly person or you've got a problem with balance, then you're going to do the one laying down.
And it has to be pain-free.
Right.
So if you're doing this one, now you're turning it clockwise. If the left leg. So I turn it clockwise and I'm bending, and again, it should be pain-free the whole time. I mean, a little discomfort from the, from the turning.
Right.
I mean, it's not right now I feel a little bit of discomfort just from pressure.
But it's not the knee pain.
Not the knee pain, no. All right, moving on, Brad.
Okay, for straightening it, I like to use a chair with some wheels and sit on another chair, so get it out like that. And here it's not straight. I'm going to put my hands here and gently work and pressure on, pressure off.
If you don't have a rolling stool, you can just put it on a regular stool, but
Right.
a rolling stool does work better. It's helpful.
If it's a regular stool, so that, I'll put a towel down if it's a wood top, so it slides a little bit, so it gives you a little movement there that's free. And then you can hold, you can do some oscillations. Whatever you do, the longer you do it, you should get more range of motion with less pain.
The thing about something like this is you don't necessarily have to do it once a day for like 15 minutes. You can do it throughout the day, when you're sitting in your chair, and you can do a set of 10.
Sure.
And then, you can do that every hour if you're tolerating it.
Right.
The first day you may only want to do one set of 10.
Right.
And then see how you tolerate it.
Sure.
And the next day, do some more. You can start increasing it.
Let's say you go through your test, and this test feels pretty good, and you get it pretty straight. Well, then we also want to check, it's how the meniscus is.
Sure. So we're going to see this. The meniscus is the cushioning in between the knee bones. So actually, if you look on Napoleon here, we actually have one in red here.
Right. So
that's the cushioning between the joints. Helps.
Can you see that red, Lonnie? There you go. Now your meniscus isn't red like that. It's actually white, but white on white doesn't show very well.
No, it doesn't show up very well.
There's a number of tests to test a meniscus. These are two simple ones that we think are good for the lay person.
Easy to do.
And I just had a meniscus patient a couple months ago, and this was a perfect test for her. And she would point her toes out, bend her knees like this, and then do the duck walk.
Yeah.
And in her situation, she would get down like this and just start to move, and it was painful, so we stopped.
Sure.
We started exercises, and then she would test her own self to see if it was improvement.
Sure.
With that test, so
it's a good idea, yeah, because it's something you can test yourself then. Another one is to do more of the one leg test where you actually bend the knee, and then you can actually do kind of a twist like this.
Yep, you do the twist.
Come on, baby. So
that was in 1962, Bob, when they started that twist dance.
Oh, I'm glad to know that you know that.
Yeah, I just learned it.
I was 17 years old. No.
Yeah. But anyway,
I was 2 years old.
When you do this, you're going to feel it be painful, some sharp pain in the knee.
Yeah.
Okay.
And that's what's nice about this is you can test one versus the other.
Right.
So
now, if this test is positive, here's some simple exercises you can do to get going on this.
We actually just did a full video on this. So
right.
Yeah. Right.
There's just simple straight leg raisers, and try to keep the knee perfectly straight, because it may lag a little bit like this, but we want it like this if you can, and then you're going to start working it here, and you're going to bring it up and as high as you can, with a little hamstring stretch, and 10 to 15 of these controlled. You're not flipping it around, but good control just before it touches.
The other foot is flat on the ground.
Yeah,
flat on the bed.
Don't do it like this. It's much better if you do it here. Okay, and then lay on one side, leg straight. Don't point the toe up like this. Point it like this, because we want that adductor to work there. Okay, 10 to 15 of those. And then on the other side, we're going to work the adductors this direction.
So we got the front, the outside, inside.
Right.
We're getting all the muscles here.
Then we want to work the hamstrings. I'm going to pull my heel down
pushing the heel down into the mat like that.
And I'm going to pull, hold it for 8 to 10 seconds, 1001, 1002, all the way up to 8 or 10 seconds, and then relax it. And do that at least 3 times, okay? And then after that, we want to go to this feeling better. And we're doing some walking, but stairs are still maybe a problem.
Sure.
Partial squats, Bob?
Oh, sure.
You want to show them that?
Sure. Well, again, the whole thing with these, whenever you're doing squats, we're trying to stop the knee from going past the toe.
Right.
So you want to squat down like this. You're going to have to kind of stick your butt out, Brad, in order to do this right. You see how I'm not going past like this?
Right.
I'm kind of going straight down. So again, you can hang on to something, which makes it a lot easier to do. And we're only going partial, which means we're going down to about 60 degrees.
Right.
We're not going way down to 90 degrees here.
Right.
Again, that's a lot less stress on the knee, but yet you're strengthening it.
If it's down the road and it feels fine to go to 90, you could, but it's got to feel perfectly normal.
We have no problems with you going to 90.
Right.
But
okay. Now, so we went through, first of all, you assess for range of motion. If it wasn't full extension or flexion, we gave you 2 exercises. If a meniscus test, the duck walk or the twist test created pain. We gave you 3 exercises
That's
for that. And now the next thing, not last, was it not least, but last?
Last but not least.
There you go. Thank you, Bob. They're going to have
now
to
we're
show.
going to be looking at the kneecap itself.
Going to show a little leg, Bob.
A lot of times with this pain, a lot of people talk about the pain being right around the knee, Brad.
Sure.
I mean, it's,
Yep.
And they might feel grinding. A lot of times worse on the stairs.
Right.
So,
Can you see that the patella moving there, Lonnie?
Yep, she's giving us a thumbs up.
So the first thing you're going to do is go right to left, but your quadriceps have to be completely relaxed. If they're not relaxed, like right now I got it tight, I'm not moving anything. So get it relaxed.
It's one you may test on both knees again too, because if they're both tight, say both could be tight.
Right, right.
You may not be doing it right, but look how well his is moving. This one does give a lot of people the heebie-jeebies. I mean,
Yep.
they don't like the idea that it moves, but it is supposed to move. And if you find like it moves in one direction very well and not in the other direction, sometimes that could be a source of problems, and maybe it's not tracking right.
Sure. As a matter of fact, the woman I worked with yesterday was having knee pain going up and down steps or even driving her car. And she said if she would grab her patella and push up this way, it felt better.
I had a lady that actually used to, I had showed her this, and she used to push it over and walk upstairs and wouldn't have pain.
Sure. So
she'd push it over while she's walking up the stairs.
Those are hints that us therapists are looking for. So what I haven't her do is at home, she's doing knee patella mobs going up like this, and she's pushing her kneecap up, stretching out the infrapatellar and the fat pads down there. Those are some structures that need to be stretched out. I worked some cross friction massage on her. We put some ice on it, and we're going to try. She's 31, so she hasn't had time yet.
And a lot of times you might find the kneecap is tight in every direction, so you can stretch it in every direction.
Right.
So you can stretch it to the middle, you can stretch it to the outside, you can push down, and you can push up.
Right.
Usually not any harm in doing any of these things.
And this is one that probably if a person does it to themselves, they do it better because they're more relaxed.
Right.
Even when Bob's doing it, of course I don't trust Bob about anything.
Yeah, I noticed you tightened up on me.
He's pushing my kneecap around. Get away from me. Anyways, it does work well when you do it to yourself. So I think that's a pretty complete assessment from the knee, from range of motion, meniscus, patella.
Yeah, it's a good start. I mean, that's we're covering probably a good majority of the problems you might have with your knees.
You better believe it. So once again, we covered everything here, Bob, but there's still one part of the body we're working on, that broken
heart.
Yeah, the broken heart, but we're going to get there, Bob. Yeah.
There it is.
It's coming in.
We're going to fix it.
Yeah, what, see that
We
fracture
can fix this
line?
about anything.